All right, it is 9:30, so. Craig, you ready? Everybody ready? Karen? Okay, good morning, everybody. I'd like to call the meeting of the Human Services Committee to order. Karen, please call the roll.
Chair Swarzy,
Here.
Member Cahill,
Here.
Member Garcia,
Here.
Member Dessart, Member Galassi,
Here.
and Member LaPlante.
Here.
And I forgot to do this. I'm, a physical quorum. Oh, Dawn's here too. Okay. A physical quorum of the members is physically present. I will entertain a motion to permit those members not physically present due to personal illness, disability, employment,
Second.
or for business of the board or family or other emergency to participate by video or teleconference. All in favor, say aye.
Aye.
Opposed? Okay, thank you. Welcome, Lynn. Welcome, Dawn. Okay, do we have any public comment?
No public comment.
Okay. I do have some things I'd like to chat about this morning under chair remarks. So we all know what the big concern is with food insecurity and with SNAP benefits and what's going on. And Mary's going to talk a little bit more about that very shortly. But yesterday, myself, Vice Chair Garcia, Chair DuPage County Chairwoman Conroy, our Chief Administrator Nick, our Chief Communications Officer Joan, and our representative, the Director of Loaves and Fishes, Mike Cavallo, met yesterday to discuss what's going on and what can the county do. So we are developing a plan, which we don't have yet, but we're talking about, you know, the number of people that may be affected by the loss of SNAP funds. Comes out to around 39,000. Well, there's 39,000 households in DuPage County that receive SNAP, and that to replace that food would be roughly around $14 million a month. Yes. So obviously, the county does have funds available in various sources. Certainly not that kind of money. But we're trying to develop a plan, and I'm going to ask Mary to come up here to talk a little bit more about what is going on. I mean, there's been the state's doing some things, you know, the judge, the courts have ordered, you know, to use emergency funds or whatever to pay for SNAP. So I'll let Mary come up and talk a little bit about what's going on.
Sure. Well, and I may ask Gina to, if I miss anything, but well, I mean, the primary thing that we're doing is making sure that individuals are aware of the resources available through food pantries. There's, 47 different food pantries in DuPage. All of them are going to be stretched. They all certainly anticipate an increase in demand. I probably saw in the news that the administration yesterday said that they will be releasing funding, but it's only enough for basically half a month. How the state, that funding has to go to the states and the states have to dole it out. I think it could be potentially a couple of days, if not a couple of weeks, before they actually figure out how they're going to calculate who gets what and how that will all work. So in the meantime, like I said, we're making sure folks are directed to food pantries. We're having conversations about if the county were to, provide some funding to food pantries, what's the best model to use? There's, we've had a couple of different approaches in the past of how we've provided support to the food network overall. And so we're asking a couple of the large pantries to kind of put their heads together and see what's the best way for us to assist them. We've on the community services side, we've increased the number of emergency food bags that we have available for folks who walk in who are in need of food. We're also ramped up our purchase of Aldi gift cards, which we're purchasing those out of something called DSSA, which is actually a charitable fund that we have that's attached to the department. I will most likely be putting out an email to all employees asking people who are interested in helping support neighbors to make contributions to DSSA so that we can step in when folks show up, if a senior reaches out, we can assist them, or if a family comes walking in, we can provide. Obviously, as Chair Schwarzy said, there's, the assistance that we can provide is, I mean, it couldn't even call it a Band-Aid, I mean, it's, yeah, that, when I looked at that number, that 13, $14 million a month in SNAP benefits that come to DuPage, it's a staggering amount. It's a staggering amount. I think we're the second largest, outside of Cook, where the DuPage has the second highest number of SNAP recipients in the state. I think that's about all I have.
So, couple quick questions before, and then we'll go to questions. So, Craig, you put that up. Our communications department put, well, the press release came out last week, if you saw, from Chair Conroy talking about 211.
Yep, that's
And then there's also information, if you see that ribbon at the top in blue that says find a food pantry near you, that's on every page of our website. And then it brings you to this page, and Craig, you can scroll down and it'll show you sort of an interactive board on where to find your local food pantry. So I think, these are good things. We serve the county, I believe the number is somewhere in the neighborhood of 10% of DuPage residents use food pantries. And not all of, I mean, most of, I think the number came out, most of SNAP doesn't.
Yeah.
And so now we're,
Wait, say that last part again that you just said?
most of the people who use food pantries aren't SNAP
Aren't on
recipients.
Oh,
Yeah,
okay.
so now you add that
Mhm.
to the group, so and that's why these numbers are staggering, so.
Member Schwarzy, can I also, Craig, could you scroll down just a little? The other thing that board members should know, so there's two things. This is DuPage County /.gov/food, real easy. Just, you can click on the website. But also, because of that increasing need in the food pantries, we are using Giving DuPage to try to get folks to volunteer and help out. So if you have constituents wanting to know what to do, they can go to that page and get direction.
And just one more thing I want to say, and we can have the discussion here among the questions. So Chair Conroy obviously put, I think it was roughly around $2 million for food, specifically line item for food. And then there was another discussion about another 1 million. But what we have found out that we have 2.1 million left in our small human services grants accounts. And I just think that the timing is needed. And if we use it, we use it. If we don't use it, then we can come back to the small human services grant. But I'm looking for our human services committee to see if we can get consensus on moving that 2.1 million out of the small human service grant and move it directly into a line item for food. And we can open it up to questions here, and Mary, everybody here can help answer. So, yeah, sure.
Yes, thank you. There is nothing more important than providing food for the people and children of DuPage County. So I would 100% support moving that $2.1 million for food insecurity. Absolutely, without a doubt. So how is the 211 call center working out? Have you received a lot of calls and everything?
Gina, are we getting food calls?
We're getting more, we had started getting more calls last week.
Okay.
So the calls are increasing, but we were not inundated yet.
Okay, okay. I'm just hoping the message gets out there to the people who really need help and the children that are hungry. And if we could somehow advertise that 211 more everywhere so that people know what's available and where the resources are.
And the Daily Herald did do an article on this last week and talked about the SNAP and talked about 211. How many people see that? I don't know.
Yes, that's
Right.
We can also take a look at our, at the hits on 211dupage.gov to see if we're getting, because, calls, we can measure calls, but we can also measure the number of hits on the website.
We had a huge uptick, a huge share rate and hit rate on that press release last week. It was, it seemed to hit right at the right time because everybody seemed to want the information. And so I'm hoping at the end of the month, when we get our stats, we'll know that this page helped drive some traffic as
And
well.
Joan, can you directly share with the municipalities, the cities, the
They get it,
villages?
that's part of our list. They get it.
And the townships. Great,
Yep.
thank you.
They automatically are on our list to get that stuff.
Two things I was gonna say. One is, just kind of to follow up with your idea of asking your, staff if anybody wants to help. Giving Tuesday, it's December 2nd. I realize that's a month from now. And hopefully this gets resolved by then, but, maybe we could add that to, our promotion on Giving Tuesday to focus on this direct issue. And then secondly, I think this is happening, but I just want to make a comment. Loaves and Fishes, I know is kind of the organizer in the center of the food distribution of DuPage, but it's very, very far from District 3. So I just want to make sure that, all the districts are getting equal.
We are having that conversation with them, and I'll let.
Yeah,
Mary-
when we met with Mike yesterday, we talked about making sure that whatever model we come up with, it's geographically, they're an enormous provider of food, but they're in a far corner of DuPage.
Yeah,
And so, and we've looked at the largest pantries, that serve, between 5 organizations, they serve 66% of all, food pantry, clients across the county. And so, whatever model we come up with, we'll make sure that other organizations that are distributed in other parts of the county are equally supported.
Okay, wonderful. Go ahead.
Yeah, we also need to be mindful of the organization's capacity to take on additional commodities. So do they have the parking? Do they have the volunteers? Do they have the storage space? That kind of thing. But yeah, what the logistics of folks trying to get down to Naperville or wherever, that's just not workable for people in.
Yeah, that's what I was gonna say,
And
especially like the
Bill,
Brazil Lake
yeah.
Terrace community
Right.
that really
Yep.
desperately needs
Yep.
it. So.
And just so you know, that's an important issue with me
Yeah.
being on the northwest side of
Yeah.
DuPage County. So we'll make sure that this model does as much good as it can throughout.
Yeah, yeah.
Okay, Eastern DuPage County has tremendous need, as you know.
Yes, yes,
Yep.
yes. So,
Okay, thank you.
Mhm.
any other? Oh,
Lynn has her-
let me go to Member Garcia and then I'll go to the screen. Thank you, Craig.
Yeah, I mean, the meeting yesterday was extremely eye-opening and frightening, quite honestly, in terms of the critical need. So in terms of putting any of our small agency grant money toward food insecurity, I'm 100% behind that. Because right now we have to take care of our immediate need. And if people aren't eating and they're suffering because of that. That's where we have to focus on. So I just want to say I'm 100% behind that. So.
Thank you. Let me go to Member LaPlante.
Thank you, Chair Schwarzy. I would like to just get a little information on really tangible logistical things that we can do, all 18 board members. Is there like a social media package that we can have that is distributed to all 18 of us that we'll be able to basically plug and play, on all of our platforms so that we can,
Yeah.
yes, Joe.
Hi, you know what? Ever since this crisis has started, I haven't changed our social media, which is the 211 food graphic. That's a simple and easy to share on your phone everywhere. And I haven't changed it because I want to get that basic messaging out. 211 and food, that's it.
Yeah.
And
Not
right
the
now,
not
I
the
think that's
website.
what I'm gonna stick with because we want to drive our traffic to 211 so that they can get live assistance. Because what assists, and Mary can probably speak to this and Gina better than I, but what also happens when you get on 211 is we find that people are eligible for other programs that the community services can help them with. And that's a more holistic solution than, and everybody's got a different situation. So some folks might need rental assistance. Some folks might be eligible for LIHEAP. We want to capture those folks.
Okay, so you want us to focus on the 211 and not this website, not the webpage.
Well, you can certainly give the website out if you have someone who's simply looking for a food pantry, but for folks in need, I like 211 better, perhaps you
Okay.
guys do too, because it allows them to get access to more services.
Okay, then perhaps just to make sure that all board members are included in this, is that we could just send an update and just say, please share this graphic.
Sure.
And then the second question I have is, can we get a list of the most needed items for the food pantries collectively? I know each pantry has something different, right? But if there was something simple that we could share, these are the, top 10 things that most food pantries need, if for folks who want to help out that way, because we're all going to have to pitch in. I mean, that's what's gonna have to happen. We're gonna have to just start sharing resources, which is, I can't believe I'm saying these words out loud in the year of our Lord 2025, but that's what we have to do. So if we can find a way to really consolidate that message and have an ease of sharing, I think that would be very beneficial to people in DuPage County.
Thank you. And Paula, did you have something on that or?
I just said that I just copied something from PRC, People's Resource Center, and that has the most needed food pantry items, which I can share with the whole committee if you want to see that. And I can
Yeah,
share it
that's
with-
exactly what I think that if we're going, we should be leading on this, right? Like,
Yes.
to the point that we have the second largest SNAP users in the state. We have to make sure that we have like really clear and concise messaging. So as opposed to, all of us sort of hodgepodging lists, if we could just come up with one that is easily shareable on our platforms, that would be a really great way to get the message out.
Great idea, Member LaPlante. Thank you. And we'll make sure we get that to you. Member Dessart.
Thank you.
Oh, thank you, Chair. I just want to give a different point of view, and that is that right now, at the beginning of this food insecurity crisis, organizations and individuals are diving in to help out. They're diving in. I've had people call me saying, where's the best place to volunteer? Where's the best place to send a check? So right now, people are stepping forward. Organizations are stepping forward. Foundations are stepping forward. I think in a month or two, 6 months, I hope not, but 6 months from now, that's when the critical crisis will come, because right now people are stepping up. In a couple of months, they're going to forget about it or not. We're going to want to feed the food insecure. And as many have said, or Mary said this, that I'm sorry, I'm driving to my surgeon right now, or I'm not driving, my daughter's driving me. But as Mary said, the 2.1 million is a Band-Aid right now. And I think, as I told Greg, and I had a great conversation yesterday, as I told Greg, I think we need a more sustainable solution. So here's what I said to Greg. I sent him this text this morning. In today's Daily Herald, there are articles saying that SNAP will be funded through November, and that other community organizations like the Daily Herald, Robert McCormick Foundation are assisting in the county's efforts to help the food insecure. Regarding the 2.1 million for the small nonprofit grants going instead toward food insecurity, I believe it's wise to make a plan for the near future and continued support of the food insecure. However, at this time, I'm not ready to use the 2 million from the small nonprofit fund. And here's why. Regarding that small nonprofit fund, this money goes a long way toward helping our organizations thrive and program their year ahead. And we also told them that this is a 3-year program, and I don't want to pull the rug out from under them. And lastly, many of the small nonprofits that we support through this fund already help the food insecure job training, professional wardrobes for job interviews, etc. So I believe that not continuing with the small grant program for the 3rd and final year is short-sighted. I think too much will be lost for a short-term gain. And I was just suggesting that we find another way, a solution to help the food insecure in DuPage County and kind of make a long-term plan. Like if this $2.1 million would be a Band-Aid, then perhaps we go into our reserves because it is a crisis. And our job is to feed those who are food insecure, make a longer term plan. And again, right now, organizations, individuals, people are stepping up to raise awareness, try to help in any way they can for the food insecure. But in the long term, I don't believe those organizations are going to be available, and that's when we need to really step in. Thank you.
Thank you, Member Dessart. Member Galassi.
I forgot to say in my comments that I fully support the idea of moving the small grant funds, the 2.1 million, to this urgent need right now. I think it's, like Member Cahill said, I think we have to, feeding our people is the most urgent need right now. So I fully support that.
Any other comments? So, and I am grateful for our conversation, Member Dessart, yesterday, and I 100% understand where you're coming from. I also understand that even with the federal government dipping into their emergency funds, like I think it was Mary who said it's going to take a lot of time. You know, you can't be paid retroactive in food. You know, if they get this money ready and it's a month from now, what are you gonna do for the next month? I mean, again, I look at Maslow's hierarchy of needs, and what's at the bottom of that? Food, and people have to eat, and so I do support moving this 2.1 million into a line item for food. And so we don't have to vote on it, but I would like to get a consensus on moving this 2.1 million to a food line item. Okay, and opposed? Okay, so 5-1 to do this. So what we'll see, I think it's at our next meeting, that this will be a budget transfer item.
Finance.
No, at finance, you would raise it for the entire, this concept, raise it under older new business.
Okay,
And based upon what you as a board give direction, we will then move it accordingly.
okay. So my request to everybody on this committee is talk to other members who are not on this committee and see, you know, try to gather that support to do this. So before our next meeting. So, okay. Yes, Member Vader.
Thank you, Chair. I am not on the committee, so I would have been a part of the consensus if I was. I think that's a smart idea. I just cannot imagine children showing up to the classrooms hungry and how it's impacting their education. And just families are struggling right now, and we need to do everything that we can. So thank you for your leadership. My question is for you. You mentioned about DSSA. Is it only for employees to donate into it? Can anyone?
Anyone can make a
Okay,
donation.
so if you help
Yes.
amplify DSSA's mission and help others to encourage others to donate, is that it?
Absolutely.
Okay,
Yeah, absolutely.
thank you, I appreciate it.
Okay. All right. Thank you, everybody, for that good discussion. Moving on to our agenda items, I'll take a motion to approve item 25, 2692, Human Services
So
Committee
moved.
regular meeting
Second.
minutes, October 21st, 2025. Any discussion? All in favor, say aye.
Aye. Sorry.
Dawn and Lynn, you both are muted, but I see your mouse move, so thank you. On to item 6, I'll take a motion to approve item FIR 19025, acceptance and appropriation of the Illinois Home Weatherization Assistance Program, DOA, Department of Education grant for program year 26 for the weatherization
So moved.
for the
Second.
period July 1st, 2025 through June 26th, 2026, in the amount of $638,116. We had a motion and a second. Any discussion? All in favor, say aye.
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 Okay, opposed? Thank you. I'll take a motion on HSP 5425, recommendation for the approval of a contract to DuPage Federation on Human Services Reform to provide face-to-face and telephonic interpreter services and translation services to assist clients in community services, primarily for the senior services unit, and to provide American Sign Language services,
So moved.
both for the finance department and community services for the period December 1, 25 through November 30th, 26, for a contract total amount of $34,000. Motion and a second, any discussion? All in favor, say aye.
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 Opposed? Okay, thank you. I'll take a motion on budget transfer item 252693, transfer of funds from the information technology service account and the travel expense account to the regular salaries account in the amount of $5,000
Second.
to cover deficits for regular salaries for fiscal year 25 that were not foreseen during budget preparation. And we had a motion, a second, any discussion here? All in favor, say aye.
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 Opposed? Okay. Take a motion on item 252694, transfer of funds from the furniture, machine, equipment, small value account to the equipment and machinery account in the amount of $2,960 to cover the purchase of a walk-behind sweeper that housekeeping will use at animal control for cleaning epoxy flooring. We had a motion and a second, right? Any discussion here? All in favor, say aye.
Aye.
Okay, opposed? Okay, thank you. Take a motion on, let's see, take a motion to combine consent items 8A through 8G.
Second.
Okay, all in favor, say aye.
Aye.
Opposed? Okay. Take a motion to approve 25-26-95 Air Gas USA. This purchase order is decreasing the amount of $31,292.09 and closing due to purchase order expiring. Item 25-26-96 Alpha Baking Company. This purchase order is decreasing the amount of $10,098.88 and closing due to purchase order expiring. 25-26-97 Hill Mechanical Corp. This purchase order is decreasing the amount of $43,293.06 and closing due to purchase order expiring. Item 25-26-98 Integral Construction. This purchase order is decreasing the amount of $64,512.25 and closing due to purchase order expiring. 25-26-99 Medline Industries, Inc. This purchase order is decreasing the amount of $14,443.06 and closing due to purchase order expiring. Item 25-2700 Northwestern Medicine, Central DuPage Hospital. This purchase order is decreasing the amount of $10,342.88 and closing due to purchase order expiring. And 25-2701 The Standard Companies. This purchase order is decreasing in the amount of $51,341 and closing during purchase order
Second.
expiring. Motion and second. Any discussion? All in favor, say aye.
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 Okay, thank you very much, everybody. On to residency waivers. Janelle is on Zoom here.
Good morning. No, we don't have a residency waiver today.
Oh, sorry. DuPage Care Center, I knew that. DuPage Care Center update, Janelle.
Absolutely. So we currently are not in any outbreak, no COVID. So that's good news. 2 south, 2 north, 2 center construction is getting towards the latter stages and hopefully will be done by late November. The challenge will be if we're still under government shutdown, then we will not have a survey architect or a nurse survey to come and survey that space for occupancy, but we still have some time. So, and we submitted a revised certificate of need to the Health Facilities Planning and Review Board to include the East Building. And that was submitted early, timely, and thoroughly. So we're really happy about that.
Thank you very much. Any questions for Janelle? Okay, thank you very much, Janelle. On to community services update, Mary Keating.
Thank you. In terms of the government shutdown, we do have one item that has sort of raised its head and a delay that we're having with a project. So the Glen Ellen Full Circle Communities project is slated to receive both it's called community project funding. It's those, used to be called earmarks, congressionally directed funding from Representative Ramirez's office is in that project, as well as some of our HUD home funds. The process is that after our environmental review is completed, there's a 30-day comment period. After that comment period ends, then HUD issues our the authorization for the release of funds. Public comment period ended on September 30th, so they would have done it the next day. October 1st would have been the day for the release of funds. There is a process under the HUD lapse plan that you can get an exception to get things released. We're currently working with folks both in the Chicago office, the folks in the HUD Chicago office. There are a couple people working, and they're working with the few people that are working in the HUD headquarters office to try and to see if we can get an exception to that rule and get that issued. Without that release authorization to release the funds, Glen Ellen can't demolish the property, and they have to demolish that property, and then the real estate closing will be scheduled after that demolition. Because we don't have a scheduled date for the real estate closing, that's one of the things that you needed to be granted an exception, was if there was a scheduled closing date. So our staff is trying to work with the HUD staff. I do have a meeting scheduled next week. I'll be in Washington. I have a meeting scheduled with Representative Ramirez's office, so I will make sure that they're aware of it because we're the ones who are actually administering it. So that's just a big frustration because, then there's tax credits involved and there's deadlines for when they have to have it constructed. And so it's a major frustration. And then you want me to talk about pads now or under new business?
You go ahead.
Okay.
I have a question.
Oh,
Can you
yeah.
remind me of the Full Circle and Glen Ellen, how many units is that? 6,000.
want to say 37, but I don't remember off the top of my head.
Let's look at 39.
39, yeah. High 30s, low 40s, somewhere around there.
Thanks.
I'm sorry, I don't remember the name off the number off the top of my head. You may recall that last year, actually, Member Garcia brought it to the attention of the board, the need for sort of, additional spillover space for pads during the winter months. The interim housing center is full all the time, and they typically have a waiting list of individuals who they can't get into the IHC. I will say what PADS does is when the IHC is full, if they come across a family, PADS puts them up in a hotel so that no child has to sleep in a car or in an unsafe space. With the winter months coming, they're more concerned about the folks who are either unsheltered or are perhaps in a car or some other location that's not safe to be outside. So they came up with a couple of different ideas, but really the best idea is to request funding for that additional capacity for the winter months. And so we'll be discussing that at finance next week. Pads will be here. April Redzig will be here to talk about it. Just for a heads up.
So I recall last year the same thing. So they came forth during the winter months, and how much do we end up giving? Do you recall?
400. Yeah, it was 25.
Okay.
It's a combination.
This year it would be,
Foundation.
344. That's the amount of ARPA interest we have left.
Okay.
370 is what
Okay.
their estimate was. 344 is what we have available in ARPA interest.
We did, last year, if you remember, we did split because there was a fundraising campaign.
Right.
That looks like not likely this year, so the 344 would be the entire cost for DuPage County.
Sure.
Any questions? Thank you, Mary.
Sure.
Okay. I forgot to ask at the beginning of the meeting, do any of the members have any comments? Okay. Any old business?
Just one thing to tie in on your construction, we've had, or your conversation earlier, we've had a lot of animals surrendered at the county, due to the fact that, financially, because of no food. And then reaching out, started with just the fish food pantry in my district, and it's expanded to multiple food districts, People's Resource Center, Hinsdale Family Services. They, also say there's a large demand for the residents to come in, for animal food, specifically wet cat food. So, December 6th, Saturday, we're doing a big drive for animal food with combined shelters, or excuse me, food pantries in the district. And also, we're going to be putting emphasis on also bringing food there. It started with fish and it's expanded to pretty much the ones in District 3. It's going to be emphasis on food, but actually on animal food, but we're going to be asking people to also bring food. And it's kind of growing. I got a couple of mayors now involved, and we're also got some service organizations that want to help out in the various towns. So we're kind of finalizing the details, but it will be December 6th. But it's,
Will it be at the animal?
no, it's going to be at Fish Food Pantry, probably People's Resource Center in Westmont, Hinsdale, and we may do a fourth location with Mecca Mosque because it's right across the street from Hinsdale Terrace, and that may be Pepper Galassi's team over there, as we may do a competition amongst some communities too. But some of the Rotary clubs, Lions clubs want to get involved for their respective communities, but started with the emphasis on the animal food, but it's going to morph into also bringing maybe the list of all of that. So we're working out the details now.
Send an email to the board on.
Yeah, once we get it all finalized, we're just to get more details, and more people want to get involved now. And so we're trying to think of a way, we may have a prize for whichever community gets the most, dropped off, et cetera.
Wrong committee, I know Animal Services where I should be asking this, but I know that we've had people who are finding themselves with no food for their family and then their animals. And so then they also are finding themselves unhoused. So I know there was a program where the Animal Services were able to take their animals for a while till they found some housing. But I know we're getting crowded in Animal Services due to the overabundance of cats and other animals. Is that still going on?
We've been doing it mostly just with the DuPage Health Department. So when they have somebody that needs to go in for a couple of days and they're worried about doing that because they got a pet at home, we've been kind of working with the health department and
Okay.
taking those animals for a couple of days. And people now have been, glad to relinquish for a couple of days, and then we actually look at the animal. And then with the new CRC, but it kind of formalizing policy, but we've been helping the health department. We haven't expanded it yet to anybody else.
Yeah.
We're just trying to work with the health department, when they see cases of somebody that needs to, go to a facility for a couple of days for some treatment or whatever it is, to take care of their animals, because a lot of them were reluctant to leave their animals.
Exactly. Okay.
Thank you for sharing, Member Krajewski, and I know how traumatic it must be for families to have to give up a pet, because they have to choose between food for themselves and for.
Well, and maybe it ties into this. We did have a big press conference a couple of weeks ago that was bipartisan with both senators from the Republican, Democrats and House members. But one of the big things was they're going to be looking at Springfield is rent. Maybe putting caps on a lot of these apartments require $50 deposit each, or $50 a month additional rent for your pet, plus like a $500 deposit. And it's making it unaffordable, let alone the cost of the apartment, and now an additional cost for the pet. So the legislation is going to be looking down Springfield to maybe cap the deposit or cap how much you can charge each month.
Keep us informed, yeah.
Oh, sorry, no, I scratched my head.
Okay, any new business? Okay, without objection, we are adjourned. Thank you, everybody.